Can a novel aldosterone synthase inhibitor help treat uncontrolled hypertension? Which hepatitis B vaccine is more effective for people living with HIV? This and more on today's JAMA Editor Summary. Hello, and welcome to our listeners around the world. Today is July 3rd, 2025. I'm Dr. Kirsten Bibbins-Domingo, Editor-in-Chief of JAMA and the JAMA Network. For this episode, I'm joined by JAMA Deputy Editor Dr. Preeti Malani. Hello, Preeti. Let's get started.
Hi, Kirsten. JAMA published a Phase 3 randomized clinical trial investigating Lorundrostat, a novel aldosterone synthase inhibitor for uncontrolled hypertension. Dr. Saxena and colleagues enrolled over 1,000 participants to receive either different dosages of Lorundrostat or placebo for 12 weeks. The primary outcome for this study was the change in participants' systolic blood pressure as measured in an office setting. The authors concluded that 50 milligrams of Lorundrostat once daily significantly reduced systolic blood pressure compared with placebo in participants taking 2 or more antihypertensive medications. They also note that the medication was well tolerated and associated with a low incidence of hyperkalemia.
We also published a research letter about the longer-term results from the Beehive trial by Dr. Marks and colleagues. The Beehive trial, which was published earlier in JAMA, evaluated the seroprotection of the hepatitis B-CpG vaccine in people living with HIV who have had a prior non-response to the standard hepatitis B virus vaccine. Specifically, in that trial, they reported that 2 and 3 dose hepatitis B vaccine with cytosine phosphoguanine adjuvant achieved a superior response compared with the 3-dose hepatitis B vaccine and the standard aluminum hydroxide adjuvant. In this current research letter, we have more data on the durability of the seroprotection response, 1 year or more after the vaccine series, again demonstrating higher seroprotection results with 3 doses of hepatitis B-CpG.
Dr. Collins and colleagues wrote a viewpoint about healthy aging in people with HIV. They advocate for investment in key areas like geroscience, patient-prioritized care, and age-friendly health systems that can help support people aging with HIV. And JAMA published another viewpoint about the importance of maintaining the Housing First model. Doctors Fetters and Barocas explain why ending Housing First policies threatens health outcomes for people experiencing homelessness. Kirsten, you and JAMA Executive Editor Dr. Kirsten wrote a perspective piece together with Professor Boumiel. It discusses the recent ruling on the Kennedy versus Braidwood Management Incorporated case, which ensures that U.S. Preventive Services Task Force recommendations given an A or B rating are covered by health insurers without cost sharing and provides clarity on the supervisory authority of the HHS Secretary.
There's some very nice clinical content this week at JAMA. Dr. Morin and colleagues have a review article about osteoporosis. They summarize the most recent evidence-based practices, including imaging recommendations and anti-resorptive therapy initiation criteria. Dr. Morin and JAMA Deputy Editor Dr. Mary McDermott discuss the diagnosis and management of osteoporosis on the accompanying JAMA Clinical Reviews podcast.
So osteoporosis actually affects both men and women. In fact, it is a very common condition. It is said that approximately 54 million Americans and over 200 million people worldwide actually live with osteoporosis. In terms of fractures, which is, as I mentioned, the clinical consequence, so we know that 1 in 3 women and 1 in 5 men over the age of 50 will suffer a osteoporotic-related fracture in the remaining of their lifetime. So fairly frequently. Many people believe that osteoporosis only occurs in women, but it does also affect men to a significant degree.
Peripheral artery disease is another important and well-known condition often diagnosed in older adults. Dr. Consul and colleagues wrote a JAMA clinical guidelines synopsis of the 2024 guideline for the management of lower extremity peripheral artery disease, developed by the American College of Cardiology and the American Heart Association.
And the JAMA patient page this week is about interstitial lung disease. Patients can pick up some quick facts about idiopathic pulmonary fibrosis and other less common causes of interstitial lung disease.
As always, you can find the latest articles in clinical medicine, biomedical research, public health, and health policy written and researched by our outstanding JAMA Medical News team at jamamedicalnews.com, or you can click on the link in the show notes.
Thank you for tuning in to hear what's new at JAMA. These highlights were brought to you by Dr. Preeti Malani and me, Dr. Kirsten Bibbins-Domingo. This episode was produced by Shelley Steffens and Dr. Krista Roberts at the JAMA Network. A link to this content can be found in the episode's show notes. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thank you for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.